Now, coming to the intra-articular fracture of lower end radius. When you look at the intra-articular fracture of lower end radius, there is a fracture with the displacement of the wrist. If it goes anterior, the wrist goes anterior, it's called as volar. And this intra-articular fracture is called as Barton. If the wrist goes posterior, it's called as a dorsal Barton. Volar Barton is more common than dorsal Barton. Treatment of extra-articular fracture, you can treat by cast, but intra-articular, you apply plates. So it is treated by fixation. If I look at the normal anatomy of the wrist on the lateral view, you have the radius, you have the anterior going scaphoid, in the center you have capitate, and it sits on the moon-shaped bone called as lunate. The blood supply will come from the distal to the proximal. The fracture of the scaphoid occurs at the waist, the mid portion. So the blood supply to the proximal pole is hampered, causing death of a bone due to poor blood supply, called as avascular necrosis. There is tenderness in the anatomical snuff box, classical. Scaphoid fracture through the waist, you can see it here. Everybody should know how to draw a radius, a scaphoid sleeping over the radius, and the lunate next to it. When I look at the anatomical snuff box, the tenderness at the scaphoid is classical, but there are two more you should remember: the trapezium and the base of the first metacarpal. I remember when I was very close to qualifying a PGI exam, this was a question asked. Tenderness in the anatomical snuff box indicates. In PGI, there were multiple answers correct. I marked only scaphoid, and I did not mark these two. I nearly missed an ortho seat there. In fact, the rank prior to me, ortho was picked up. And it's so close. You know, this is from Gray's Anatomy. I understand that big books are difficult to approach, but anatomical snuff box has been asked for the last 25-30 years universally. At least we can read 2 paragraphs on it. We can. So a good student is not the one who avoids reference books, is the one who knows where to look at, read and come out. So read the references book, refer to them, they are important. And then the position for immobilization, the first metacarpal or the thumb is in line with radius, called as the glass holding cast. That's how you hold a cast. And if you rarely require to operate, usually humerus and scaphoid are not operated. You can use a headless screw because it's inside the joint, called as the Herbert screw. This is the avascular necrosis. Dead bone is white because the blood supply makes the bone osteopenic. So it's a white bone. And scaphoid, just to recapitulate, tenderness in the anatomical snuff box, most common carpal bone to fracture, fractures at the waist, distal pole fractures occur in children, blood supply is distal to proximal, glass holding cast. When the scaphoid and lunate, they dissociate, then sometimes there can be a gap between the two. This gap is like a gap between the tooth of this gentleman, called as the Terry Thomas sign or the David Letterman sign, seen in scapho-lunate dissociation. In this condition, sometimes the scaphoid looks like a ring also called a ring sign. So O-ring sign we saw in chordomas. So it was O-ring sign. When there is a chondroma inside the bone, O-ring sign. Ring sign, scapho-lunate dissociation. Rim sign, seen on MRI in chronic osteomyelitis. Rim, ring, O-ring. O-ring, chondroma. Rim, MRI, chronic osteomyelitis. Ring, X-ray, scapho-lunate dissociation. And coming to the fractures of the base of first metacarpal. Somehow the base of first metacarpal is something that examiners love. So when there is a fracture involving the base of first metacarpal, along with a dislocation. It's called as a Bennett's fracture dislocation. And when there's only a comminuted fracture of base of first metacarpal, it's called as a Rolando fracture, only fracture. So Bennett's is a fracture dislocation. Rolando is only a fracture. So when I started studying, I remember preparing for entrance exam, I remember my senior walking to me and telling me that remember the paired fractures, Coley's and Smith, Monteggia Galeazzi, Bennett's, Rolando, they are very commonly asked. So I started remembering them. And in the book that I was reading at that time, it was given there that Bennett's is an intra-articular fracture with a dislocation, and Rolando is an extra-articular fracture of the base of first metacarpal, both involving the same area. Now, I thought that it's confusing, so why not to make a mnemonic? At that time, there was a soccer player of Brazil called as Ronaldo. It's not the Portugal Ronaldo, different Ronaldo. So I made a mnemonic, Rolando, Ronaldo. Ronaldo is an extraordinary player, so Rolando is an extra-articular fracture. And so Bennett's is intra-articular with a dislocation. And I went around and spoke to everybody about my mnemonic. You know, my college, I was roll number 11 and roll number 10 was university topper. Not the college topper, the university topper, the absolute topper. He was a different class. His knowledge, his vocabulary, the way he used to give the vivas, he was just the top notch. And I happened to go to him also. And I told him that this is a mnemonic I have made. But he made a cut on my book. We all had a book of mnemonics where we will write down the important mnemonics and the tables. And we'll always keep it with ourselves to remember at the end, to revise at the end. In the last 7 days, last 24 hours, compiled together all 19 subjects. But I never gave up, so I wrote it again in his diary. He again tore it off. And I looked at him, and everybody was looking at me. I was telling a mnemonic and he was not listening to me. And roll number 10, as he was, university toppers are different. For those who are not understanding, it's very difficult to be next to university topper because your papers are checked next to him, you give a viva next to him. And it's very funny for the teachers because the level that he would set and the answers I will end up giving. One of our teacher actually asked me, are you a student of MBBS? That was a contrast that man had drawn. But anyways, I didn't give up. I told the entire college my mnemonic, Bennett's and Rolando. Wrote in every diary. Sometimes I autographed it also. मैं रहूं ना रहूं, मेरा नाम रहना चाहिए. And as the year went by, I followed the rules. The rules were study less, revise more, make a way that under stress you are able to mark the answer, verify. Never hesitate to look into the textbooks on something which is controversial or something that you're not sure of. But then don't waste too much time on things. Move ahead. Because it's about how many times you can go around it. And as the time went by, we wrote aims. I didn't qualify. Went for PGI. PGI at the end of internship was a phenomenal time. And when I went there, you know, it was like a picnic. The entire compartment of Shatabdi was booked. Snacks and everything were given complimentary. Apart from that, we had packed things for us to eat. Singing, enjoying. I took care of everything. When I reached Chandigarh, all my batchmates were praising, fantastic arrangement. Then I went to my senior, Dr. Tarun Mittal. He was ranked 17 in PGI last year with his first attempt. He was staying next to us in Mamsi hostel. He was the first good thing that happened to us in entrance exam. We started believing that somebody amongst us can qualify. And I had a special affection for him, and he would always give me time. When I reached there, I went to the security guard. He had kept my key. I went to the room. I remember India and Australia cricket match was being played. I lied down on the bed, started seeing the match. I dozed off. When I got up in the morning, Sir was sleeping on the ground. I hopped over him. With the noise I made, he got up and said, "I'll get the breakfast for you, get ready." And I said, "Sure." He got the breakfast, I got ready. He said, "I've taken a half day off." He was finishing his first year. Getting a half day off was special. But then he always told me I was special for him. He took me to my center. The entire way I was praising Chandigarh. He looked at me and he said, "Have you studied?" I said, "Yes." He was quiet. Didn't look so happy about it. On the gate, he looked in my eyes and said, "All the best, Apurv." I said, "Thank you, sir." When I came back, I said, "Sir, take me for food somewhere." And he took me to one of the places for lunch. He ordered my favorite food. And Dr. Tarun was a class apart, is a class apart. He visualized at times when we didn't understand things. He always dreamt of becoming a bariatric surgeon. And he heads a unit now in Gangaram Hospital in Delhi. And Dr. Tarun, as he was, and people around were talking to him for the questions and answers. And in spite of 1 year from his selection, he was answering everything. Rose Dr. Tarun Mittal nahi hote. They are not born every day. And the way he was engaging everybody, hats off to him. I was in a different world. I thought, this is something else. This is not the paper I gave. And when I was returning back, he told me, "Apurv, start studying. I think it's tough." And I didn't understand why he would say that. When I reached back in the evening, he called me and he told me that total number of students were 4,200. My rank was 3,800 odd. I was precisely wrong in the entire paper. And then he started speaking all the language that he could. I had never heard such a great vocabulary. He was abusing me. I had great respect the way he was doing it. And he told me, "You should study, don't do that." I was a resistant child, a stubborn man. My conscience was still not up. I thought it was just a bad exam. I could not see the mistake I had. I kept on studying. We went for All India, second Sunday of January. The exam was tough. We got a question. Rolando fracture is. Everybody looked at me after the exam and said, "Your mnemonic has come." I was famous in the college for it. Bennett's and Rolando. I said, "Okay. मेरा जन्म आपका भला करने के लिए हुआ है. I've been born to benefit you people." In fact, one of the girls held my hand and said, "Thank you." Right? And I was so happy. I could do good to people. Then came the second Saturday of February. It used to be Delhi PG exam. Same day All India result used to come, and all my friends were waiting for the result to come. It used to be like Diwali in Mansi. There were so many toppers and All India used to come. I was scared. After the PGI result, I was scared. I packed my bag, wanted to go back home. Some things meet you often. Some people meet you often. I met Rolando again. Delhi PG, it came again. Everybody in the hall started looking at me, the people from my college. And I said, "Don't worry. I was the boss. My mnemonic had featured in 2 top-notch exams." Thank you continued. I came to my home and I was waiting for 11 in the night when the bell rang. Bell rang, and the bell said, my best friend was rank 97. My roommate was rank 3 All India. After hearing this result, I was filled with energy. And I thought I will be rank 1 or 2. Because if your best friend and your roommates are 97 and 3, that's what you feel. And I was happy. I was happy because my friends had done so well. And I asked Harry, rank 3 All India. Who's rank 1? Roll number 10 was rank 1. With the difference between rank 1 and 2, which is undefeated in this country for last 17 years. People have crossed 1,000 out of 1,200, but still that difference between 1 and 2, still untouched. Roll number 10 was class apart. I was waiting for my result. My father walked in. I told him, Saurabh is 97, Harry is rank 3. Saurabh, my dad said, let me congratulate their parents. And then he looked at me and said, what about you? I said, come and let's see. Never do that. Never involve your parents in seeing the results. That's a blunder. I entered my roll number. The website, which was not opening for so long, the moment my father was standing here, it clicked open, tuck. There was a big digit that flashed. I told him, these are the number of individuals who appeared for the exam. After 30 seconds, my dad kept a hand on my shoulder and said, that's your rank. This is what you've got. I was shocked. My question was, when you have minimal seat, why do you declare such ranks? Did you ever check what could happen to us after declaring the ranks? And I looked at my dad and said, hard luck. He said, it's not luck. You know, luck is here. To qualify, the level is here. There are two different levels. The gap has to be bridged. And he made the statement of my life. Said, you didn't study well. I said, I didn't study well. What are you talking? He said, what do you know about entrance exams? He said, yes, you didn't study well. Then I said, look towards my mother. She walked in. I said, look at what Papa is saying. I didn't study well. She said, yes. I felt very bad. Two individuals who mattered so much to me, this is what they had to speak about me. I said, Dad, I promise you, I will become something and then only walk in this house. He looked at me and said, how will you survive? What will you eat? Where will you stay? And I realized he was right. I said, sorry. And I walked inside my room. I didn't understand what was happening. My head was down. My father walked in and asked me, tell me the colleges where you will take up a seat. I said, I'll take up orthopedics into Delhi colleges or SMS Jaipur, KGMC or PGI. I told him this. He said, promise, nobody will touch you for 1 year. But after 1 year, you will do whatever I tell you. I said, promise. I just wanted him to walk out. I called up Dr. Tarun Mittal, PGI landline. The guard picked the phone and said, are you Dr. Apoor Mehra? I said, yes. He said, Dr. Tarun was waiting for your call. Wait, these were the seniors we had. They were our parents away from home, praying for us. And then he started speaking, what not. All the abusers were back. He said, study. Don't change the books. Read and revise what you studied. Whatever got you bad ranks, if properly revised and practiced as MCQs, will get you good ranks. I knew the path. I started preparing. I was a different man. I stopped eating with my family because that meant 45 minutes. I did speak to them. I did laugh with them. I did sleep well. I would watch a 2-hour movie at 1 week, but I'll practice a lot of questions. I would be sticking to the basic questions that were coming and the topics that were coming, and I was revising more. Then came the mid-PGI. In the mid-PGI, when I went there, this was a different man who went for the exam. I went a night prior. I slept on the ground. Didn't have the courage to sleep on the bed of rank 17 PGI. Got up in the morning before Dr. Tarun. Didn't want to eat. Got ready. He dropped me again. I was quiet the entire way. I was focusing. I was planning the strategy of my exam. I said, can I ask you one thing? He said, yes, Apoor. I said, sir, if all the 4 answers in PGI are correct, and the 5th is all of the above, what should I mark? He told me, Apoor, mark only all of the above. because the first four are included in it. You never mark an answer twice. And he smiled. And then he said, "All the best," at the gate. I don't know what happened. I went back, I touched his feet. He was shocked. Coming from a man like me, I went and wrote the paper. Paper was tough. It was really tough. When I walked out, Dr. Tarun looked at my face. I started asking him questions, he started replying. This time the paper made sense to me. I remember he took us for the lunch, and by the time the kadai paneer and by the time the dal makhani came, I was asking him questions. And I spoke again. Tenderness in the anatomical snub box. And he said scaphoid, trapezium, and the base of first metacarpal. I had only marked scaphoid. One of my seniors was on the same table. He had marked scaphoid and trapezium. Dr. Tarun Mittal was correct. I got up, didn't have lunch. I said I need to work more. I took the bus, came back. In the evening, I got a call. Dr. Tarun told me, "You are rank 91. My senior who marked trapezium for the tenderness in the base of anatomical snub box was rank 67. He picked up orthopedics. Ortho got over at 90. I was 91. I never qualified PGI again. I went back. I started preparing well. When I looked at my diary of mnemonics, it came to me. If Rolando is a fracture which is comminuted involving the base of first metacarpal, it must be intra-articular. I checked in orthopedic textbooks. Rolando is intra-articular. Bennett's is also intra-articular. Bennett's is intra-articular with a dislocation. Rolando is no dislocation. Rule number 10. Tearing out those pages where I was writing this mnemonic. Knew this beforehand. That's why he was rank 1 on India. That's why he has a record untouched. That's why he was roll number 10, university topper. And he didn't want to tell me the answers. You know why? Because he knew that I would not even listen to him. As things went by, after 3 months I spoke to my dad. The All India matrix had came. Of all the colleges that I wrote, there was only one seat in general category. I looked at the man who 8 months back told me that you have not studied well. I told him, "Dad, there's only one seat." And this is what he spoke. Even if there's one seat in the universe, it belongs to my son. He just has to focus for next 3.5 months. Friends, till the time I am alive, I will never hear anything more motivating. माँ बाप के मुंह से निकली हुई बात तो कभी गलत होती नहीं. What he spoke eventually was true. I did take up that seat, the only seat. I ended up being an orthopedician. Whenever I read the word Rolando, I remember the way I went around the campus speaking about it, and most importantly, the summary of this entire thing. Fool is loud, wise is quiet. People who want to do well, they put their head down and they study. They are only worried about 2 things. They will look at the mirror in their room every day and at the end ask, "Did I waste time today?" And if the answer is yes, next day they'll work harder. Number 2, they will look at the stopwatch and study, not sit, study, which is so important because people spend time with books, don't convert it into proper planned MCQ art. That's what we call it. Then the reverse Bennett's is a fracture involving the base of fifth metacarpal. Then the Broxer's fracture is the fracture involving the neck of the fifth metatarsal. Bennett's fracture is also very common in boxers, but the boxer's fracture is the commonest. Wrist dislocation, the radius, the lunate, the capitate, they are in one line. If the lunate comes out, all other bones stay there. It's called as a lunate dislocation. And when the lunate stays, all go out, it's perilunate dislocation. Perilunate is more common. When the lunate comes out in the AP view, it looks like a pie, called as a pie sign. And in the lateral view, it looks as if the teacup is falling, called as a spilled teacup sign. You can get questions on this. And then when you look at the injuries which involve the joint injuries, the patient cannot move his joint and neither the examiner can move it. So active and passive movements are restricted. But in non-articular injuries like the biceps tear or the humeral shaft fractures, the active movement can't happen. I can't do it, but you can hold my limb and do that. So passive is present. Coming to the complications of trauma, this page is a summary. CC, compartment syndrome, tight cast. MM, myositis ossificans, history of massage. SS, Sudex dystrophy, sympathetic overactivity. FF, fat embolism, usually occurs in a shaft femur fracture, usually after 48 hours, but nowadays they are giving you scenarios in less than 48 hours also. CC, MM, SS, FF. So, compartment syndrome, cast. Myositis ossificans, massage. Sudex, sympathetic overactivity. Fat embolism, femur fracture, 48 hours. Now, 48 hours, I just told you, has been debatable recently, but still. Most common area of compartment syndrome, deep posterior compartment of leg, followed by deep flexor compartment of forearm. Many books mention about forearm, but leg is more common than forearm. Earliest symptom is pain out of proportion to injury. Earliest sign is stretch pain, and that too at the distal most joint of the extremity. Remember, compartment syndrome is a microcirculation or capillary network affection, so the pulses are normal. Normal compartment pressure less than 11 millimeters of mercury. Calf pressures, just for a comparative data because questions come on it, 200 to 300 millimeters of mercury. Compartment syndrome is an emergency. Treatment is fasciotomy. You release the skin, the subcutaneous fat, the fascia, and decompress the muscles. Indication, pressure more than 30 or neurovascular compromise. Usually, you have to watch for the word paresthesias, indicating that the neurovascular compromise is occurring. Pressures or loss of pulses is usually not the answer. It is the paresthesias with a stretch pain that should trigger fasciotomy. If you do a release of the deep fascia and save the muscles, the results are okay, but if you don't do that, it will lead to permanent shortening of the muscles called as contracture. Because of the lack of blood supply, ischemic contracture, after a man who described it, Volkmann's ischemic contracture, also called as VIC, which is more common in upper limb, deep flexor compartment of forearm. The commonest muscle involved is flexor digitorum profundus, followed by the flexor pollicis longus. The nerve involvement is in the order of AMU, Aligarh Muslim University, anterior interosseous median ulnar. Turnbuckle splint is applied for it. So you have a flexion deformity, you have a splint which is a buckle, keeps on straightening it out. That's how it looks like. This is the buckle, turnbuckle splint, and then you have to sometimes release the muscles along the flexor aspect. As they will slide down, they will decrease the deformity, called as a muscle sliding operation after a man who gave it max pay. The name is not important, the procedure is. Sometimes the turnbuckle splint is confused with turnbuckle cast, which is used for lateral deviation along with the rotational limit of spine called as scoliosis. And the second complication of trauma, myositis ossificans. There'll always be a history of massage. Patient had an injury around elbow, a child. Usually, parents took to an osteopath who did a massage. Then there's a loss of movement. That's myositis. Usually unilateral, around the elbow. Most commonly involves the muscle brachialis, followed by biceps. First 3 weeks, immobilize, put a cast. After that, ask the patient to do only active mobilization, because passive mobilization is equal to massage. Beyond 1 year, if there's no relief, you operate. Whether it's compartment syndrome, whether it's myositis, whether it's Sudex or fat embolism, prognosis is never good. But what you should remember, fat embolism has a worse prognosis. This is how the myositis looks like. So calcification and ossifications around the joints are important for you to remember. Then comes Sudex dystrophy. Complex renal pain syndrome has a name for it. There is sympathetic overactivity. There is a Langfors triad in it, which you have a stimulus, a trauma, activity, sympathetic overactivity, a response. Because of the sympathetic overactivity, you'll have red hot shiny skin, and because of more blood supply, there will be resorption of the bone called as patchy osteopenia. It's type 1 post-traumatic after Colles fracture. Remember, most common complication of Colles is finger stiffness. Most common cause of Sudex is Colles. Or type 2 after a nerve injury, the median nerve, also called as causalgia. This condition, continue exercises, results are poor. Since we are doing complications of Colles, I was waiting for this page to come in. Most common complication of Colles, finger stiffness. Second complication is malunion, causing dinner, fork, deformity. Next complication of Colles, carpal tunnel syndrome. Next complication of Colles, rupture of EPL, extensor pollicis longus tendon. Next is Sudex. These are the important complications of Colles that you must remember, but the most common is finger stiffness. People think it's malunion and Sudex. It is not. That's how the red hot shiny skin looks like, normal. That's how the osteopenia looks like, hollow bones, and you can see a malunited Colles, history of trauma.